or church family, when we invite our friends and our family members, we are meeting their needs, but also we aim at helping each one live a healthier, happier life. And that is one of the main goals of the Adventist Health Professionals Association, to meet the needs of our community. And so it is my privilege for us to meet and listen and encourage others to attend this evening's sitting titled The Silent Impact: Chronic Diseases and Your Eye Health. Chronic diseases and your eye health. Let's bow our heads for prayer. Dear Father, thank you for being God all by yourself. Thank you for being a great physician and being interested in every aspect of our being, including our health, and more specifically, our eye health. Please, Lord, I ask you to allow the technology to work uninterrupted, that the message that you have given our presenter, that it will be clearly articulated, that all of us, we will take action immediately. Thank you for providing every resource that we will need. And thank you for bringing more persons on so that they can get this message, not just now, but those who will watch and experience this recording in the future. In the name of Jesus, amen. Is none other than Sister Abigail Cezair-Mahadeo. She is a beautiful daughter of the Most High God. She describes herself as a faithful disciple of Jesus Christ. She's a certified optometrist for the last 10 years, and she presently works at a private eye clinic. She graduated with honors from the University of the West Indies in the spheres of optometry and biology. She's married to the love of her life, Pastor Cezair-Mahadeo, for the past 4.5 years. She's genuinely interested in helping persons experience the best out of life, out of their health, and to experience vision. And here it is. We know that we can experience vision not just physically, but through that spiritual discernment that Jesus desires to give us. And just in terms of housekeeping, I'm inviting you to place your questions in the chat, and I will collate them at the end this evening, at the end of the session. So please place any questions, any comments for Sister Abigail in your chat, and we will address them at the end of the session. Do keep your mics muted so that we'll have a clean recording, so that those of us or friends or neighbors who would listen to the session afterwards, that they will understand and hear clearly. So may God bless us as we now invite Sister Mahadeo to the podium. The floor is yours.
Thank you so much, Dr. Bakmaya, for that introduction. As she rightly said, my name is Abigail Cezair-Mahadeo, and I am an optometrist by profession. Just give me one moment. Let me share my screen, please.
How did you get?
One moment. Let's see. Are you guys hearing me okay? And you can tell
Yes,
me
we're
if you're seeing
hearing
the
you
screen as
loud
well.
and clear.
Yes, I'm hearing you.
Okay, great. So the topic this evening is the silent impact, chronic diseases, and your eye health. So this is just a brief overview of what we will be looking at this evening. Chronic disease and systemic health, the impact of chronic disease on eye health, diabetes and the eyes, hypertension and the eyes, autoimmune diseases, other chronic conditions, mechanisms of damage, the importance of regular eye exams, management and prevention strategies, and of course, the conclusion. So what is a chronic disease? Chronic diseases, also known as non-communicable diseases, are defined broadly as conditions that progress slowly and have persistent effects on a person's health and quality of life. They are as a result of a combination of genetic, physiological, environmental, and behavioral factors. A chronic disease can be managed through ongoing treatment and lifestyle changes. So, okay, great. So key characteristics of chronic diseases, they have a long duration. So chronic diseases typically last a year or more. They have a slow progression. They often progress gradually over time, but may have periods of increased or decreased severity. They are persistent effects. They can cause ongoing health problems and impact a person's daily life. There is no cure for chronic diseases. While there may be treatments to manage the condition, most of them don't have a cure. And they can have a significant impact. They can lead to disability, reduced quality of life, and increased health care costs. And they require ongoing medical attention. So chronic diseases in the world, at least 43 million people have died from non-communicable diseases in 2021. I couldn't find any research later than this. And that's equivalent to 75% of non-pandemic related deaths globally. 18 million of those who died were below 70 years of age. Of all the NCD deaths, 73% are in low and middle income countries. Cardiovascular diseases accounted for most of the deaths, followed by cancer, chronic respiratory diseases, and diabetes. These four groups of diseases account for 80% of all premature NCD deaths. According to PAHO, in Trinidad and Tobago, non-communicable diseases or chronic diseases account for 62% of deaths every year. Over half of the population has at least 3 risk factors, but many people find it challenging to choose healthier lifestyles. So some chronic diseases in Trinidad and Tobago include cardiovascular diseases such as heart disease and stroke, various types of cancer, diabetes, in particular type 2 diabetes, chronic respiratory diseases, and asthma, and autoimmune disorders such as rheumatoid arthritis, lupus, type 1 diabetes, and certain thyroid diseases. So we would, on a few of these today, this evening, we wouldn't touch on every single one of those. So who is usually at risk? People of all ages, groups, regions and countries are affected by chronic diseases. They are often associated with older age groups, but about 18 million of those deaths occur before the age of 70, as we said before. And NCDs cause more deaths in this age group than all other causes of death combined. So risk factors of chronic diseases, these include tobacco use, unhealthy diets, including excess salt, sugar, and fats, harmful use of alcohol, and insufficient physical activity. The social, commercial, and physical environments are key drivers of these behaviors. Continuing on risk factors, these are modifiable. So behavioral risk factors that contribute to 4 key metabolic changes. These include raised blood pressure, including hypertension, being overweight or obese, high blood glucose levels, including diabetes, and abnormal blood lipids, which includes high cholesterol. The non-modifiable ones include your age, your heredity, such as genetics, and your sex, whether you are male or female. So how do chronic diseases affect the eyes? Chronic diseases, they can affect every system in the body, and of course your eyes, they're no exception. Your eyes, they don't exist in isolation from the rest of the body. That's why there are various eye conditions that can affect the eyes, and many of them are very common. Eye complications can be early signs of chronic diseases or develop gradually over time. The intricate blood vessels, nerves, and tissues of the eye are vulnerable to systemic damage, and managing your overall chronic health is paramount to protecting your vision. So before we go on, I think it's important that I give you a brief overview of what the eye structures look like, so you'll have an understanding of any pictures that may follow. So this is the internal anatomy of the eye. We have the iris, which is the colored part of the eye, and it could be different colors, either green, brown, gray, or blue. Then you have the cornea, which is the clear dome at the front of the eye. You have the pupil, which looks like a black dot in the center of the eye when you're just looking at someone, but it's actually a hole that allows light into the eye. You have the lens right behind. It's a clear oval shaped disc that focuses the light at the back of the eye. It's very small. It's shaped just like a lens would be actually. Then you have the vitreous humor, which is a gel inside of the eye, holding it in place and providing nutrition to the eye as well. We have the retina, which is at the back of the eye, the lining at the back. We have the optic nerve, which takes information from your eye to the brain to interpret what you're seeing. And the macula, where all the light that's coming into your eye, it's concentrated at this little point, and it helps you to see details as well as color. So the retina, which is the lining at the back of the eye, it's a light sensitive tissue, and it converts light into electrical impulses that are sent to the brain through the optic nerve. So you can see the blood vessels, they're both arteries and veins and capillaries. You have the macula, which is the light sensitive area that helps you see detail and color. And then the optic nerve, which is that kind of yellow disc on the right-hand side there. So how chronic diseases can harm the eyes? So eye complications are sometimes the first noticeable sign of an undiagnosed chronic condition, or they can develop gradually over many years. So some examples of this is diabetic retinopathy, which we'll talk about later on. It's an early indicator. And then you have glaucoma, which progresses slowly, and it's more noticeable in advanced stages. So we have diabetes, and these are the things that can occur, chronic diseases with diabetes and the eyes. So you have diabetic retinopathy, macular degeneration, glaucoma, cataracts. You have high blood pressure, and you have those things taking place as well. You have autoimmune diseases, and you have other chronic conditions. So we will first begin with diabetes, a sweet danger for sight. Diabetes is a common metabolic problem in which the sugar in the blood is abnormally elevated. There are several types of diabetes, but the most common forms include type 2 diabetes, where your body doesn't make enough insulin, or your body cells doesn't respond normally to the insulin, which is called insulin resistance. Then you have type 1 diabetes, which is an autoimmune disease in which your immune system attacks and destroys insulin-producing cells in your pancreas for unknown reasons. And then you have gestational diabetes, which some women develop during pregnancy. However, it usually goes away after pregnancy, but you have a higher risk of developing type 2 diabetes later in life. So diabetes can affect all structures in the eyes. You have the cornea, which is the clear window at the front. So usually you'd get decreased corneal sensitivity. So like if dust and stuff goes in the eye, you wouldn't really feel it. You have reduced corneal wound healing and increase in abrasions. So when you blink, you'll actually feel like the eye feeling rough. Then in the iris, you have neovascularization, which is little capillaries that actually grow in the colored part of the eye, which is the iris. It's also called rubeosis iridis. Then diabetes can affect the lens inside of the eyes. You can get blurred vision due to a swelling of the lens. So what usually takes place, excess sugar in the lens. So sugar could get into the lens of the eye, first of all, and then when there's too much glucose, it produces a sugar alcohol called sorbitol. And when this is produced, it doesn't escape from the eye readily. So it tends to accumulate in the lens over time. And when the sugar goes back to normal, you get like an influx of water because of osmosis, and this could swell the lens. Your vision goes back to normal after your blood sugar stabilizes in the early stages, but later on, you would continue to see blurred. And then cataracts, which is a clouding of the lens in the eye. This can be created due to diabetes. So we'll talk a bit on cataracts. So it's a clouding of the lens of the eyes. The lens is usually clear. There are various types of cataracts, but the one that is associated with diabetes is cortical cataracts. So we usually call it cortical spoken as well. So it looks like the spokes of a bicycle. So looking at the pictures below, so that usually when we take a look and we see that, we usually think, okay, this person has diabetes. So it begins as a white wedge-shaped spot, and then it gradually grows towards the center of the lens. And of course, when this happens, it disrupts the structure of the lens, and it diminishes its transparency, so the lens itself gets cloudy and you cannot see as clearly as you could before. So this is how you'd see with normal vision on the left side. On the right side, everything will look hazy and blurred. So diabetic retinopathy, which is a complication of diabetes. This affects the retina, which is the lining at the back of the eye. And the sustained high blood sugar levels damages the delicate blood vessels throughout the body. In the eyes, it affects the tiny vessels that supply the retina. And these damaged vessels can leak fluid, they can grow abnormally, or they can stop the blood from passing through. So on the left side, you see what a normal retina looks like. And on the right-hand side, you see what a diabetic retina looks like. So you'd see spotty spots of blood in the eyes. In the middle, it has swelling of the macula. Not all diabetics, thankfully, will get this. Once your sugar is controlled, it wouldn't get to this stage. But if your sugar isn't controlled over time, it can eventually lead to this. And it's usually not painful, and you may not notice any vision changes until the disease itself becomes severe. So diabetes has different stages. So the first one, there's no disease visible. Stage 2 is mild proliferative diabetic retinopathy. So you have swelling of small blood vessels in the retina, also called microaneurysms. You have moderate NDPR, where you'll have like little small bleeding in the eye. You'd have cotton wool spots, which is areas that the blood not supplying anymore in the retina. Then it'll become more severe. And then proliferative is the final stage where it's a whole mess in the eye, honestly. So you have new vessels taking place. You have bleeding throughout. You could have what we call retinal detachments, where the lining at the back of the eye actually pulls forward, and it could be filled with like fluid. Let me just jump to the next slide so you can see. So that's one on the left side is what we call a pre-retinal hemorrhage. So it's bleeding in the jelly of the eye, and it's right in front of the macula. So of course you wouldn't be able to see clearly. Interesting that it looks like Trinidad a little bit. And then the picture at the top on the left. On the left, on the top, that's where you see the hazy part at the top, that's a retinal detachment, and has a picture below showing you exactly what is happening. So with diabetes, how you'd see like black spots. So you wouldn't see clearly. You would see floaters, you'll see dark or empty areas in your vision. And eventually some people, they lose their vision completely if it reaches to the last stage. So who's usually at risk? Pre-diabetics, persons who are overweight or obese, people who don't exercise regularly or at all, your age as well, depending on how old you are. If you have a family history of diabetes, then you are very predisposed to diabetes. Your race or ethnicity, if you had gestational diabetes before, if you have high blood pressure, if you have abnormal cholesterol levels, and if you smoke. So we'll briefly talk about glaucoma as well, which is the silent thief of sight. It's a chronic condition that causes damage to the eye's optic nerve, and it gets worse over time. There are different types, such as primary open angle, acute, normal tension, secondary glaucoma, which is due to diabetes, congenital, which means it's existing from birth, and traumatic. And the ones in bold are the ones that we would term as being chronic, so slow progression and long duration. So the eye constantly makes a fluid called aqueous humor towards the front of the eye, and this nourishes the eye. As new aqueous fluid flows into your eye, the same amount should drain out. The fluid drains out through an area called the drainage angle. So if you look at the picture, you'd see the arrow. So where the fluid forms, that area is called the trabecular meshwork. So it's right behind right in front of the lens of the eye. It passes through the pupil, which is the hole, and then it drains on the outside of the iris. So this process keeps pressure in the eye stable. But what can happen over time with glaucoma, if that angle is blocked for whatever reason, the fluid cannot flow out, and the fluid that's inside will continue to build up, and it will cause the pressure to increase. And this pressure affects the retina and the optic nerve by causing permanent damage to the nerve, and it affects the circulation of the blood in the retina. Diabetics have a greater risk of getting glaucoma. It affects the circulation of the blood as well, and it affects the optic nerve over time. The optic nerve itself is made up of millions of tiny nerve fibers. So the fibers are like electric cables made up of small wires. That's kind of like how they are. So they as they continue to die, you will develop blind spots in your vision. You may not notice these blind spots at first, because it usually starts on the outer part of the eyes and it gradually comes in. And once all the fibers are gone, you become blind. So this is a picture of a normal optic nerve. And then the one on the right is optic nerve with glaucoma. So as you see, the area in the middle, all of the nerves have gone, and you're actually seeing inside of the nerve. So usually when it's at this point, most of your vision have already gone. And we call it tunnel vision. So it starts from the periphery and comes in. So people who have glaucoma, usually they can see pretty well through the center of the eye. But if they look at the sides, the vision at the sides is usually gone. And it's scary because the symptoms are usually not noticed until it's too late most times. And there are no symptoms, so you wouldn't feel like the pressure is high in the eyes. Like we had a guy come in 2 weeks ago just for a routine check, and we checked his pressures. It was 50 and 60. The normal pressure is supposed to be below 21 for the eyes. So we sent him to do a test called a visual field test to check the vision on all in the periphery and the center of the eyes. And unfortunately, he had a lot of damage to both eyes already. So checking regularly is very important. So treatment of glaucoma could either be with the use of drops to control the pressures in the eye, and you have to use this for the rest of your life, or by laser treatment. So what they would usually do, they would make they would laser like a hole in the iris, which is the colored part of the eye, or they would remove a part of the what I call the trabecular meshwork. So they'll actually remove a part so that the fluid could flow through better. Hypertension, pressure on your vision. What is hypertension? Hypertension or high blood pressure is when the force of blood pushing against your artery walls is consistently too high. This damages your arteries over time and can lead to serious complications such as heart attacks and strokes. The blood pressure is the measurement of the pressure or the force of the blood pushing against the blood vessel walls. Your blood pressure reading has two numbers. The top number, which is the systolic, it measures the pressure in your arteries when your heart beats. And the bottom number, which is diastolic, it measures the pressure in your arteries when the blood is flowing back to the heart through the veins. So the blood pressure ranges. You have healthy, which is usually less than 120. on the top and less than 80 at the bottom. Elevated top 120 to 129 and bottom less than 80. Then you have stage 1 hypertension, which is 130 to 139 systolic, and diastolic 80 to 89. And then stage 2, and then you're in crisis when your pressure is 1 over 180, and the diastolic is over 120. So chronic high blood pressure, how does it affect the eyes? The pressure exerts a constant force on the delicate blood vessels on the retina. So over time, this pressure can damage the walls of the retina, of the vessels, leading to various abnormalities. So one such thing is called hypertensive retinopathy. It's a critical indicator of systemic vascular health. It has no symptoms until the final stages, when you begin to have vision loss or complications. So some of the changes that takes place with the retinal blood vessels, you have narrowing of the blood vessels. You have hardening, which is called arteriosclerosis. And this appears like a silver wire or copper wire. So when you look in the eye, you can actually see this kind of, the blood vessels and stuff look like it has a silver lining. Then it has leakage that can occur through the damaged vessels and into the retinal tissue. You can also have bleeding in the eye. Exudates, which are deposits of fluid and fat leaking from damaged vessels. You have optic nerve swelling, which is also called a papilledema. And then we have retinal vein occlusion. So you have a blockage of blood vessels leading to sudden vision loss. And then you have cotton wool spots, which are the little white areas. Those are areas that have a lack of blood flow to the small retinal blood vessels. And then you have macular edema. So the macula, that area could actually swell. So that's just some pictures. So the picture on the left is what we call tortuous vessels. So like in the early stages, you can actually see, instead of the vessels being nice and smooth, you actually see it's kind of jagged, like how you seeing it there. And if you look closely, you could actually see 1 or 2 of the vessels with the silver lining. And then the picture on the right, that's in the advanced stages. So you have bleeding all over, you have the cotton wool spots, you have the area of the macula that's swelling as well. So how do you treat hypertensive retinopathy? You lower the blood pressure, typically with lifestyle changes and medications. And then your lifestyle changes should include keeping a weight that's healthy for you, following a heart-healthy diet, lowering salt intake, exercising regularly, moderate exercise, and some signs of hypertensive retinopathy that actually goes away over time with treatment in the earlier stages. But if you get to the later stages, you have a slim chance of reversing the retinal damage to the eyes. So strokes, which are cerebrovascular accidents, or CVA. A stroke, also known as a cerebrovascular accident, is a medical emergency that occurs when blood flow to the brain is disrupted. This can happen due to a blocked blood vessel called an ischemic stroke, or bleeding in the brain called a hemorrhagic stroke. When blood flow is stopped, brain cells are deprived of oxygen and begin to die, potentially causing permanent damage. Since the brain is responsible for processing all visual information, a stroke can affect vision, as well as eye function, leading to a variety of symptoms that can range from temporary to permanent. So how can strokes affect the eyes? So it can damage the cranial nerves, like the third nerve, fourth nerve, or sixth cranial nerves. So there are 12 in all. So the ones that are usually affected are the third, fourth, and the sixth. This can lead to double vision, or what we call diplopia. So the eyes may not move together properly. Eye misalignment, what we know in Trinidad as pokey eye. One eye may turn inward, outward, upward, or downward. You can get blurred vision. You can also have what we call ptosis, which is like a droopy eyelid. And then you have nystagmus, which your eyes tend to move like that all the time. We have agnosia, which is difficulty recognizing familiar objects, faces, or places, despite being able to see them. You have impaired depth perception, which is difficulty judging distances, leading to clumsiness and falls. And then you may even get visual hallucinations, seeing things that are not there. So eye strokes can also affect the eyes. So there are three main ones. One is called central retinal artery occlusion. So that's a blockage of the main artery supplying the eye, and it causes sudden, painless, and severe vision loss to one eye. It's considered it's a medical emergency. So usually you have, like, you wouldn't see anything in the eye, and if that happens, you kind of have to get to a hospital really quickly. They may be able to save the eye depending on how quickly you get to a hospital. Then you have branch retinal artery occlusion, which is blockage in a smaller artery, and this just causes partial vision loss in one of the eyes. Then you have it's affecting the veins. So the first two affected the arteries. This one affects the vein, where you have blockage in a vein, leading to leaking of fluid and bleeding, causing blurred vision or vision loss. So you'd usually have a sudden onset of blurred vision, double vision, partial or complete loss of vision in both eyes, what we call visual field changes, which is just loss of vision in one part of the eye. The type and severity depends on the location of the stroke in the brain and the extent of the damage. Some visual impairments may improve with rehabilitation and special vision therapy, especially if it's found early. However, vision loss can be permanent. And early recognition is crucial not only for overall brain function, but also minimizing potential health damage, eye damage, sorry. So those are two picks. The first one is a central retinal vein occlusion. So it's usually indicated by a cherry bright spot right in the macula, and the rest of the retina around looks pale in color. And then the second pick is also the branch retinal artery occlusion, which isn't as significant, but it will affect vision in one part of the eye. So we'll touch on autoimmune diseases and eye health. So an autoimmune disease occurs when the body's immune system mistakenly identifies its own healthy tissue as foreign invaders. This leads to chronic inflammation and damage to various organs and systems. While there are over 80 recognized autoimmune diseases, many can have significant ocular manifestations. So it can affect the eye in different ways. So I'll just talk about two. One of them is rheumatoid arthritis. So it's a chronic autoimmune disease that causes pain, swelling, and stiffness in the lining of your joints. It most commonly affects the joints of your fingers, your hands, your wrists, Knees, ankles, feet, and toes. It usually starts to develop between the ages of 30 to 60, but anyone can develop the condition. So how does arthritis affect the eyes? You could have a number of things happening. You have what we call dry eyes, when the eye itself feels dry. You can have uveitis, which is an inflammation that affects the uvea. So I put the second pic to show what the uvea is. It's the iris, the ciliary body, and the choroid. Then you can have scleritis, which is an inflammation of the sclera, which is the white of the eye. You can have peripheral ulcerative keratitis, and this is where the cornea gets inflamed and it's prone to thinning. You can have retinal vascular occlusion, where blood vessels in the retina become blocked. And as we said before, blocked vessels can prevent the light from filtering, the eye from filtering light correctly, and this can cause vision loss. So the next autoimmune disease I'll talk about is briefly, it's just thyroid disease. It's most commonly associated with Graves' disease, the one that's that affects the eye. And this is caused by an overactive thyroid. It causes inflammation and swelling of the tissues behind and around the eyes. It leads to what we call proptosis, which is bulging eyes. The person will usually get double vision, and in severe cases, the optic nerve will become compressed, which can threaten vision. So this is usually what the eyes look like with people who have thyroid disease. You'll have bulging eyes, and you get some redness, and they usually have some dry eyes as well. So it's important that you prioritize your eyes. The most crucial step in protecting your vision is to effectively control the chronic condition itself. This means vigorously managing blood sugar levels for diabetes, for blood pressure, managing the hypertension, managing your cholesterol, and following treatment plans for autoimmune conditions. Consistent medical adherence and regular monitoring are essential. So a lot of people, they don't like to use their medication. They would say they're feeling good, but it's important that you continue with the medication. And for those who don't have any chronic diseases currently, prevention is better than cure. Diet is very important for healthy eyes. You can keep your eyes healthy by eating foods that are rich in certain vitamins and nutrients. Colorful fruits and vegetables that are bursting with vitamin A, C, D, and E will give your eyes a healthy boost. And of course, limit processed foods, limit not only sugary drinks, sugary foods as well. Try not to consume as many unhealthy fats and cut down on your salty foods. And for people who smoke, you should quit smoking and just drink alcohol. Vitamin A, which is the most important eye food. So I usually say anything that's yellow or orange in nature. So of course, carrots, which everyone knows, but you can also have pawpaw, mango, you'll have your sweet peppers, you have your pumpkin, even sweet potatoes and all, those are usually high in vitamin A, which is good for the eyes. Vitamin A is essential for the production of visual pigments in the retina. It helps to see clearer, especially in low light as well. And it supports your body immune system and protects you against infections as well as diseases. And also all green leafy vegetables such as spinach, broccoli, lettuce, watercress, those are usually good for the eyes as well. Vitamin C, fruits and vegetables, they are, all of them, excellent for eye health and vision. And of course, the raw form is best. omega-3 fatty acids. So these are healthy fats that support eye health as well as heart health. They are important for proper visual development and retinal function. So some of these include fish, nuts, seeds, and certain plant oils. Some of the fish include salmon, mackerel, sardines, and tuna. And the plant-based options would include flax seeds, walnuts, and chia seeds. We have zinc as well, which is essential for retinal health and may help in preventing vision loss. And you have all of those things, so many peas, such as lentils, kidney beans, chickpeas, or chana, and then some nuts and seeds, almonds, walnuts, pumpkin seeds, sesame seeds. And we also have eggs, yogurt, and cheese, and mushrooms. So taking care of your eyes. So apart from your diet, you should also have regular eye checks because as we were saying before, many of the chronic conditions, they usually have no symptoms in its early stages. And it's only when you begin experiencing some symptoms is when the disease is in its later stages. So you should check in with either an optometrist or an ophthalmologist. Just check in regularly to make sure that the eye health is good. Some of the instruments that we use for screening the eyes, direct ophthalmoscopy. So we have a handheld device that we look into the eye. So when we look in, you can see the eye exactly how the pictures that I showed you. So you're able to see that nice orange area of the retina, and you're able to see all the blood vessels and the optic nerve as well as the macula. And the eye is actually one of the organs in the body where you could see the vessels directly. So that's how we're able to detect a lot of diseases that way. Then you have indirect ophthalmoscopy where they put this big thing with a lens and they use a bigger lens to look inside the eye. We have optical coherence tomography, which is it's a machine that creates a 3D image of the eyes inner layers, such as the retina and optic nerve, to make sure that there's no damage taking place in those layers. We have slit lamp biomicroscopy and retinal photography. So it takes a picture of the back of the eyes. The middle picture is a dilated pupil. So we'd usually recommend for people who have chronic diseases such as diabetes and high blood pressure that you get what we call a dilated fundus exam, which they'll put drops in the eyes and the pupil is enlarged. So the eye care provider is able to take a better look inside the eye and make sure that they don't miss any areas of disease progression. So healthcare providers, it's all encompassing. So ensure seamless communication between your primary doctor, chronic disease specialist for those who have chronic diseases, as well as your ophthalmologist and optometrist. Other tips for healthy eyes, regular exercise, of course, is important. It improves your overall circulation, blood sugar control, as well as blood pressure, and maintaining a healthy weight. This will reduce the risk of complications from many chronic diseases. So this brings me to the end of my presentation. I thank you all for listening.
Wow, thank you so much, Sister Abigail. Very detailed. Yes. The connection between the eye and chronic disease, I don't think we would have thought about it so much. Quite comprehensive in the approach. And indeed, our eyes are the windows to the soul, but it is the window to the entire body to know what is happening, as you have identified. Yes, so you can see where the chronic disease occurs, where it exists, by looking at the eye. And so you have let us know and reminded us, for those of us who are more aware, that we really need to be consistent in terms of being careful with our eyes and
Correct.
do our regular eye exams. And so we have a few questions in the chat,
chat.
and I'll go right up to the start. Yes, there are some persons that would have asked questions early on. And so the first question that came in, how does one's gut affect the eyes in the disease pterygium in the
The
eyes?
eyes. Okay. So while it's not directly linked, because usually a pterygium is caused by UV rays, and it's a growth that starts at the corner of the eye and gradually grows towards the center of the eyes. So while it's not directly linked, a pterygium can usually have what we call dry eyes. So you can have pretty dry eyes. So increasing your water intake, as well as those same omega-3 fatty acids and fruits and vegetables, that should help in terms of alleviating any issues in terms of the pterygium itself.
Okay, wonderful.
Yes.
There's another question. I have droopy eyelids. All right, I have droopy eyelids, and the test was done and nothing was found. I have no problem seeing from the eye. What could possibly be the cause? I also have astigmatism. I also had previous high, I think she wants to say high pressure reading,
Let's see.
and said there was glaucoma, nothing was found. What could possibly be the cause? And the readings were 19 and 21 or 17 and 21.
21,
There's a,
which are normal readings.
okay, so vision normal, so that's good to know. She also said she
Pressure,
had
sorry, in the
tears
eye.
in the back of both
Oh,
eyes
wow.
2 years consecutively. What could have caused it? The first time, and at that time, that was the first time I had spider floaters.
Floaters. Okay. So in terms of what we call the droopy eyes or ptosis, with some people, the muscles of the eyelids itself is weaker than normal. So it actually keeps the eyelids down like that. There's usually nothing that causes it, except that the muscles itself not as strong, so it doesn't hold up the eyelids as before. What could have caused the tears? So usually with the tears, it could be a number of things. With some people, if they are short-sighted, so you could probably let me know if you're if you're very short-sighted. People who are short-sighted, the retina at the back of the eye, the walls tend to be thinner than normal. So people who are short-sighted are more at risk for retinal detachments. People who are diabetic as well. And then some people who've had like injuries to the eyes, that would cause it as well. And then a fourth one is sometimes we'd come into clinic, we'll go through everything, nothing wrong with the patient. It's just that I guess that area of the eye was a little thinner than normal, so it would have pulled away from the back of the eye, unfortunately.
Okay, thank you. Thank you for your response.
Okay.
So the next question is, what causes extreme dry eyes?
So a number of things actually. So one of them is a person's diet. So if they don't have a healthy diet, they're not taking a lot of fluid into the body, as well as their nutrition is kind of poor, that could cause dry eyes, depending on your environment. So people who are very prone to Saharan dust, that tends to cause dry eyes. If you are constantly in an air-conditioned environment, and if you work in an AC environment and you're doing like computer work and stuff, and you're constantly staring at something, that will give the eyes time to for the tears to evaporate, and that could cause dry eyes as well. Yeah. And
Okay.
the fourth one is some people have a autoimmune condition called Sjogren's disease. So when they have that, that actually causes really dry eyes as well.
Okay, and so the natural follow-up question. So what is the best way to help with dry eyes?
Oh, great. So increasing your water intake, the omega-3 fatty acids that I spoke about before, that will help as well. So the eye layer, the tear film layer, sorry, is made up of 3 components. It have the aqueous or the liquid layer. It has the mucus layer, and then it has the lipid layer. So any one of those 3 could be out of sync. So with some people, if the mucus layer affected, you could actually have what you call yampy developing in the corner, and you'll start to be cleaning your eyes. People who the tear layer is affected, you'll usually have watery eyes, which sounds strange because it's dry eyes, but the eyes are so dry that it's trying to compensate for the dryness. So people's eyes will be watering all the time. And then the lipid layer, usually if that's affected, people will get what we call foreign body sensation. So if you look in a mirror, you'll actually see like little bumps on the eyelid with the glands filled with oil. So it's not being expressed to form part of the tear layer. And you'd actually feel like it have something in the eye all the time. Even if you rinse the eye, it's still kind of there. So in terms of helping with dry eyes, nutrition is excellent. For people who have that foreign body sensation, we would recommend warm eye compresses. So you get a very warm rag with water that's very warm, of course, not hot to scald your skin. And you leave it on the eye for about 5 minutes, and you do that about twice for the day, and that should help. And in some cases, we would recommend eye lubricants, not for you to use all the time, just to kind of reestablish the tear layer in the eyes. So those are the main ones.
Fantastic, fantastic. So a concerned daughter says, my dad occasionally claims his vision appears like he's seeing shattered glass, or sometimes a variety of bright colors forming pretty patterns. Can you shed some light on this condition, please?
Okay. Can you tell me if your dad has cataracts by chance? You could put it in the chat. So people who have cataracts, they sometimes complain about that, as well as if they're driving at night, the lights from the oncoming car seem very bright and scattered. So those are usual complaints. If it's not any of those, what else could it be? I know some people, if their eyes are really dry, they would see little blurred areas. So trying to think of what else could be causing that that condition
Okay.
in his eyes. Yeah.
Okay, so please, Sister Tid, if you can, just clarify so we can get a more specific, a more direct response. And so, what is the cure for floaters or flashes of light in the eye?
Unfortunately, there is no cure for floaters. So usually with the floaters are like things that are stuck in the jelly of the eye. So depending on how light shines on the eye, you would see them from time to time, as well as the flashes of light, which I actually started getting recently. It looks like if somebody's shining a flashlight in the corner of my eye, which is normal aging, unfortunately. So what happens, the jelly in the eye, it's more fluid when you're younger, and as you get older, it gets a little more rigid. So it doesn't float around as it used to. So that's what causes the floaters and the flashes, and there isn't any cure for them, unfortunately. I know they could be pretty annoying.
Indeed.
Yeah.
If the eyes are watery and also sometimes reddish, what is the cause?
So this could either be if the eyes are really dry, that can cause the watery eyes from the eyes being too dry, so it's compensating by producing more tears. In terms of the redness, if the eyes are dry as well, and people who have allergies like sinus issues, for example, they would tend to have watery and reddish eyes as well.
Mm,
Yeah.
interesting. And you know what? Our participants, they are really getting on in terms of getting the asking questions. They are very engaged. Here's another question set. Is it a problem that I keep taking my eyeglasses off to read things versus using my eyeglasses? They have the bifocal gradient in them. And any eye exercises to help?
In terms of it being a problem, there isn't. It sounds that you are probably short-sighted. So people who are short-sighted and over 40, what tends to happen, they find it more comfortable to take off their glasses to read, which is actually pretty okay. And what I found with some short-sighted people, even though it has the bifocal part, they never find it's enough. So they always find it's more comfortable just to take off the glasses to read. So probably when you're going to do your glasses, when you're going to renew your glasses, you could probably mention it to your eye care provider so they could increase the reading strength a little bit for you. In terms of eye exercises to help those with eyeglasses, well, it depends what you would probably what issue I guess you're getting. So usually eye exercises would be for people who have some kind of issue with the eyes. So like some people whose eyes are a little off, we'll tell them to do different exercises to try and bring the eye back straight. People who have what we call like eye strain and stuff from using a computer too much, we'd usually recommend eye exercises as well. People who have trouble focusing, we would recommend eye exercises for them as well. But if you're wearing glasses and you can see clearly and you want eye exercises to help you not wear glasses, that's doesn't exist. Yeah.
So there's another set of questions that came in. How will you advise on the following? And there are many parts. Those who wear spectacles always for fashion, versus eye health. And television watching and the eye.
I'm sorry,
Yeah,
I'm
this
looking for the
one
question.
came in directly to me.
To you, okay.
Yes.
Read it again for me.
Okay, so how will you advise on those who wear spectacles for the purpose of fashion versus just for eye health, as well as television, the effect of television watching and the eye? So perhaps you can
Okay,
start there.
sure, no problem. So those who wear it just for fashion, it wouldn't, I mean, if it doesn't have any prescription in it, like if you don't wear glasses and it doesn't have a prescription, it's usually okay. It shouldn't affect the eyes. If it's one of those like reading glasses and if you have it on, you're actually feeling like the eye pulling and whatnot, then I probably wouldn't recommend it. But In terms of those, just for fashion, it's okay because like sunglasses don't really have a prescription in it most times, like the regular ones, and those are usually quite okay. The second question was television watching.
Yes.
So television isn't as bad as looking at things on a screen actually. So usually your eyes at rest, they're usually straight ahead like that. So looking at things in the distance, your eyes will be straight. And then if you're looking at something close up, like a laptop or or your phone, your eyes tend to turn in like that, which would cause strain over time. Especially with children, we don't recommend them having too much screen time because we're getting a lot of children that need glasses at a younger age. But that's a whole other topic. But in terms of watching television, try for it not to be continuous. Try and take regular breaks in between because the eye is still a muscle and it can cause strain on the eyes over time.
Okay. All right.
Yeah.
Do you drink water by per pound of body weight? Okay, I think the question just has to do with how much water should you drink that will assist your eyes?
Oh, I would recommend the daily required amount. So 8 glasses a day. That should be adequate. Because I find that if it's like 4 and stuff, it's usually not enough for the eyes.
Okay.
Have diabetes, can they still have glaucoma? Yes. Sorry, I just someone asked, they messaged me directly, if someone doesn't have diabetes, can they still have glaucoma? Yes, they can still have glaucoma because glaucoma, so people who have diabetes, they can develop glaucoma, but glaucoma in itself is a whole other eye disease. So you can have nothing else going on systemically in the body, and you can have glaucoma. As well as if you have a family history of glaucoma, then you can inherit it as well. And eye drops good to use. It depends on the eye drops. So if it's specifically directed towards bringing the pressures down, it's good. If you're using like eye lubricants in the eyes, that's usually fair as well. But I know some people use some strange things in the eyes. I probably wouldn't recommend those.
Okay.
Just those that recommended by your doctors.
Okay, so here's a question. I have a small sac which appears to be liquid filled at the outer corner of one eye. What has caused this, and what can I do to rectify this?
Outer corner of one eye. So some people, they develop like little cysts on the eye itself, and then others it could be what do you call this, like lipids, oils, right? The oils of the eye could be forming there. So usually what you could probably try first is what we call the warm compress. So you take a very warm rag and put it on, try it for about 2 to 3 days. If it's not going away, then you could see an eye specialist, and they might probably just probably poke it and drain it.
All right. I
Yeah.
think that may be the preferred thing. Okay. So in terms of
Not
eye
long.
drops, how long should we use eye drops containing steroids?
Oh, not for a long time. So usually people who are on steroid drops, if it's not recommended by the doctor, for those that are recommended by the doctor, usually they would have to be monitoring to make sure that it's not having any adverse effects in the eyes. If it's for certain conditions, we kind of don't have a choice but to use the steroid drops. But if it's something that was over the counter, I would probably say 3 weeks tops, because steroids could affect the eyes negatively over time, and it could actually cause increased pressures in the eyes over time, leading to glaucoma. So I would recommend using it for a long time.
This sister says, I wear prescription glasses. My eyes have bags underneath and it burns. What can I do, please?
So the burning is probably because of dry eyes. So usually when the eyes when it's sagging a bit, you kind of have a wider area for the eyes to for the tears to evaporate and for the eyes to get dry. So I'd probably recommend some eye lubricants for it. In terms of the bags, there isn't much that could be done. Because usually we'd have patients come in and they would say they try like cucumber and stuff, but the doctors usually tell them it doesn't have anything that they could do unless they want to try some sort of cosmetic surgery. If it's really bothering you, that's the only option. But after a while, the tissue at the bottom here gets kind of loose, and that's how you get those little bags under the eyes. Yeah.
Okay. And we'll take this as the last question. What causes styes in the eye, and what can someone do to prevent this?
So styes could be because of everything leading to dry eyes, interestingly. So what tends to happen with some persons, you would have one of the glands getting clogged. So it could be dry eyes or just one of the glands getting clogged on its own. And over time, instead of it's releasing its oil, what tends to happen, it swells, and at first it hurts. And then if you don't do anything about it, it gets hard and it just remains there. So in its early stages, we usually recommend warm compresses, as well as you could get topical stuff over the counter to try and bring it down. In terms of what you could do to prevent it from happening, not much, unfortunately. Some people, that's just how their eyes are made up, and it just clogs on its own, sometimes dirt and debris. So it's just to kind of watch it and use eye compressors as well as drops, and get it when it's early, because if you leave it and forget about it, it will get hard, and then it will constantly be there, and then you'll actually have to get an eye doctor to cut it and remove the hard the hard stye in the eyes.
Okay. So we
I
need to get compresses
yeah.
done quickly.
Yeah,
think
I
someone-
just want to make a contribution here, please. Hi, thank you very much, Sister Abigail, for the presentation. What I do with styes, as you said, even dust, sometimes just sweeping, doing a lot of spring cleaning can cause the blockage. I know I'm going to share something here. We don't like to put things into our eyes, but what I've found to be quite helpful is turmeric water.
Okay.
Yeah, and so I had that some years ago, and I had to have it gashed. And when I did, the pus, if it got to the lower lid, it would infect there as well, and you'd get another one coming up. So we had to be careful they didn't have any contamination. A few weeks later, I returned for a checkup, and the doctor looked and he said, I see some baby ones in there. And I got so mad. And I just washed my eyes with turmeric water, and it worked, and it never came back. And every time someone talks to me about it, they feel a little hurt. I'd say take a tiny pinch of turmeric powder and in a little warm water so it would dissolve. And you're not going to apply it warm.
Rinse
It's
the
very
eyes.
cool. Yeah, and you just like hold it like with an eyeglass or a little cup to the eye for about 30 seconds, and it helps to clear up and clear that up
Thing.
feeling every time, no matter where in the
Okay.
world you are. It works for everyone. So yeah, it's quite
Okay, just the powder alone, or like
yeah,
if you have
the turmeric
can you
powder. If you
grate
have
it?
the root, you can certainly just boil a little piece of the root. But that is anti-inflammatory, and it seems to just help quickly. It stops within 1 or 2 washes. Yeah.
Okay,
Mhm.
interesting.
My son had it the
I'll
other
probably
day,
try.
and I told him to do that and just wash several times in the day, and that was one single day of
works.
efforts and done. Mhm.
Okay, I'll have something to
Excellent.
recommend to my patients now.
Yeah.
Here's
Thank
what it's
you.
guys for. Anyone what is for? What is that?
Okay,
Yeah,
so
turmeric water.
For the styes.
this time,
Which side?
rinse your eyes.
Oh, okay. All right.
Yes, and the crowning question of all, after all of the engagement, where can we find you?
I work at an eye clinic in Valsine. The name of the company is Caribbean Eye Institute. It's not my company. I work with 4 ophthalmologists, and I'm the only optometrist there. And usually if you type in Caribbean Eye Institute, you can get like the location. It's in Valsine, Trinidad.
Wonderful. So we can Google Caribbean Eye Institute and we can get special care from Sister Abigail Mahadeo, right? So
Yes, it's usually
just Google it.
by appointment. Because the clinic tends to be pretty busy. Certain days we have like children days, which we see like 25 children a day, just very tiring. So it's usually by appointment to make sure that you have that individual care and that you're not waiting forever and ever.
Wonderful. Wonderful.
Yeah.
Yeah, so thank you. This has
You're
been
welcome.
very informative, very comprehensive. Our, audience is quite engaged. You see, we are all
Yes,
very interested
they
in
are.
eyes. Without
Correct.
it, we don't get to see the world. And so we want to thank you very much, Sister Abigail,
You're welcome.
for your presentation that was comprehensive. It made us think, and now we have some things to look out for. We're more aware. And so with that, we would want to close. Now, we do have, we have had our colleagues from Upper Tobago, with us as well. We share this platform, with them. They share the platform and they are on next month, but they do not, they haven't fine-tuned a topic as yet. So we will keep you aware as to what they will be presenting on through the regular channels. That is what you would have been notified about this presentation about. And in fact, this presentation will be posted on the Upper Trinidad YouTube channel. So please, for your friends, for your neighbors who missed this live presentation, they can tune in to it on Upper Trinidad YouTube channel. So thank you again, and let us close out with prayer. Dear Father, thank you so much for being our healer, our balm in Gilead. Thank you for giving us eyes beyond sight, for being our Lord and Savior, being the one that sees around the corner. Help us to trust our everything, including our eyes, to you. Give us the vision that we need to understand the times in which we live and to live accordingly. In the name of Jesus, amen.
Amen.
Do have a fantastic evening, everyone.
Yes.
Be safe and tune in to the Upper Trinidad YouTube channel for more tips, for more lessons on health. God bless you.
Blessings. Blessings to everyone.
Bye, everybody.
Thank you very much, Dr. Abigail and Dr. Celeste. Thank
You're
you.
Thank
welcome.
you.
It was my
Great job.
pleasure.
Everyone, have a blessed week.
Have a
Bye.
wonderful week, everyone.
Bye.